This program will provide an overview of Medicare and is divided into 6 sections. You can find this information in greater detail in your Medicare and You Handbook, which is mailed to people with Medicare and can be found on the Medicare.gov website. For easier understanding, you are encouraged to view the parts of this series in order. Welcome to Part 2 of this series. In the last section, we talked about how and when to enroll. Now let's go over some Medicare basics. This chart provides a summary of what each part of Medicare covers. Part A helps cover inpatient care in hospitals and skilled nursing facilities, as well as hospice, home health care, and blood that you may receive as an inpatient. Part B helps cover doctor services, outpatient care, home health care, and many preventive services. Part A and B are considered Original Medicare. Medicare Advantage plans, also known as Part C, are an alternative to Original Medicare. They are managed by private insurance companies that are under contract with Medicare. These plans include Part A and B, and usually Part D. These plans must cover what Parts A and B cover, and they usually include Part D. Part D helps cover the cost of prescription drugs. These plans are run by private insurance companies that follow rules set by Medicare. Part A helps cover the cost of inpatient care in hospital and skilled nursing facilities. It also covers the blood you may receive as an inpatient in the hospital, home health care, and hospice care. It does not cover private duty nursing, private rooms, televisions or phones if the hospital charges separately for them, personal care items like razors or slipper socks, or custodial care, which is non-skilled care in a nursing home. Most people do not pay a premium for Part A. There is a deductible for Part A, as seen here. The deductible is based on benefit periods, which last 60 days. A benefit period begins the day you are admitted to a hospital or skilled nursing facility as an inpatient. The benefit period ends when you haven't received any inpatient hospital or skilled nursing care for 60 days in a row. If you go into a hospital or a skilled nursing facility after one benefit period has ended, a new benefit period begins. You must pay the Part A inpatient hospital deductible for each benefit period. Benefit periods can span across calendar years. There are also copays when you are an inpatient in the hospital or skilled nursing facility. We'll look at those on the next slides. No copayment is required for home health care or hospice care. There is no out-of-pocket maximum with Original Medicare. We'll talk about Medicare supplements or Medigaps and how those can help with these costs in the next section. This chart shows the current year's Part A costs related to inpatient hospital stays. This chart shows the current year's Part A costs related to a stay in a skilled nursing facility. Your hospital status is a complex medical decision based on your doctor's judgment and your need for medically necessary hospital care. You are an inpatient if you are formally admitted to the hospital with a doctor's order. If the doctor has not written an order to admit you, you are an outpatient. Emergency room visits are considered outpatient. If you are in the hospital for an observation status, you are an outpatient, even if you spend the night. Medicare Part A pays nothing for outpatient care. Part B pays for doctor services, hospital outpatient services, after you pay the Part B deductibles, coinsurance, and copays. For drugs received during an observation stay, you'll likely need to pay out-of-pocket and submit a claim form to your drug plan for reimbursement. You can request an out-of-network pharmacy claim form from the Part D plan. If you are in the hospital more than a few hours, ask your doctor or the hospital staff about your status. Hospitals are required to provide you notice about your status if your stay under observation is longer than 24 hours. Next, let's take a look at Part B benefits. Part B helps cover medically necessary outpatient services and supplies, including doctor services, outpatient medical and surgical services and supplies, clinical lab tests, durable medical equipment, you may need to use certain suppliers, diabetic testing supplies, preventive services like flu shots and yearly wellness visits, and home health care. This slide shows Part B standard monthly premium. It may be higher for people with higher incomes. Part B premium may be deducted from your monthly Social Security check. If your Part B premium is not deducted from your check, Medicare may bill you. Medicare Easy Pay allows people to have their Medicare premium payments automatically deducted from savings or checking accounts each month. There is an annual deductible for Part B, shown here. For most covered services, like doctor services and some preventive services, Medicare Part B pays 80% of the costs, and you pay the coinsurance, which is the remaining 20%, as long as the provider accepts Medicare assignment. Many of the preventive services are covered in full and do not require coinsurance. Since 2007, people with Medicare who have higher incomes have paid higher Medicare Part B premiums. These income-related monthly premium rates affect roughly 5% of people with Medicare. This chart shows the current Part B premiums for people with higher incomes, and the amount is based on your tax return from 2 years prior. Medicare Part B covers 2 preventive visits, a Welcome to Medicare visit and a yearly wellness visit, as well as a range of additional screenings and services intended to help prevent illness and detect medical problems early when treatment works best. A description of these services can be found in your Medicare and You handbook. You are encouraged to review these services and talk with your doctor about your individual prevention plan. Your Welcome to Medicare visit is covered during the first 12 months that you have Part B. It's important to note that this is not a physical. This visit includes a measurement of your height and weight, your blood pressure, your body mass index, a vision test, a review of your potential risks for depression and a level of safety, discussion about advanced directives if you choose, a written plan regarding screenings, shots, and other preventive services needed. In addition, the Welcome to Medicare visit includes a review of your medical and social history related to your health. When you make an appointment, let the doctor's office know that you'd like to schedule your Welcome to Medicare preventive visit. The visit is covered by Medicare, including the deductible and copayment. However, if you receive additional tests or services, you may have to pay coinsurance, and the Part B deductible may apply. Once you've had Part B for longer than 12 months, Medicare will cover a yearly wellness visit. The main focus of this visit is to create an update prevention plan based on your current health and risk factors. You will be asked to complete a health risk assessment to help your provider create a personalized prevention plan. The visit is covered by Medicare once every 12 months at no charge, including the deductible and copayment. However, if you receive additional tests or services, you may have to pay coinsurance, and the Part B deductible may apply. You should ask for the yearly wellness visit by name. Also, the yearly wellness visit is not a physical. Medicare does not cover physical exams. If you schedule a physical, you may need to pay the full cost for the physical. Your yearly wellness visit will include reviews of medical and family history, developing a list of current providers and prescriptions, recording your height, weight, and blood pressure, creation of a list of risk factors and treatment options, detection of cognitive impairment, establish a schedule of screenings for appropriate preventive services, and offer personalized health advice. Thank you. Please check out our next video on original Medicare and Medigap insurance.